This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining me this morning on Columbus Concerns. Well, of course, all the talk has been about the coronavirus pandemic, but it's regular old flu season as well, and the flu can be deadly. So let's talk to an expert this morning about getting your flu shot. Well, we're talking today about flu shots with Doc Lamberjack. He is a pharmacy manager with Kroger. And Doc, thanks for stopping by again this year.
Thanks for having me again.
I know you were here last year, but this year it seems more important than ever to get a flu shot.
Definitely.
Yeah, with all that's going on, you don't want to confuse the strain of flu with the COVID or whatever else is going on.
And we are seeing a lot more people this year come into the stores for their flu vaccine.
That's a good thing.
Yes.
Who should get an annual flu shot?
So it is recommended anyone over the age of 6 months get an annual flu vaccine. In Ohio, the pharmacist can immunize age 7 and above as of now. It is in the works where you can do age 3 and above in Ohio just to help with getting more people immunized.
When is the flu season?
So in Ohio, it typically starts December, peaks in February, and it can go all the way into April. We have been seeing some prescriptions come in already for Tamiflu or antivirals that are treating the flu. So I think it is starting to show up very mildly here. Check the CDC's website. They give a weekly breakdown of cases across the country, and still mild in Ohio, but there are some states where it's has increased already.
We're talking with Doc Lamberjack from the Kroger Pharmacy about flu shots. And is it too late to get a flu shot now?
It's not too late. We still encourage people to get their vaccine. The CDC recommends by the end of October, so we're here in early November. It takes your body about 2 weeks to build up the full immune response. So the sooner you get it, the better. Now that we are here in November, so we are recommending that everyone get that.
What about seniors?
So seniors. There's a special shot for them. It's called high dose. And so anyone age 65 and above, we do recommend that one. And it has 4 times the amount of antigen in there to give their body a better immune response.
And I guess this is a question you get from people all the time, because you always hear these stories from people. It's like, well, I got the flu shot and then I got the flu.
Yeah.
But that's really not the way it works, is it?
No. They were going to get the flu otherwise, if it truly was the flu. So some people can experience flu-like symptoms for a day or two, like headache, fever, body aches. And that's just your body's natural reaction of building up the antibodies to the virus. Because it is a killed virus when you get the flu vaccine.
Now, when you come in to get the flu vaccine at the Kroger Pharmacy, talk a little bit about the process. How does it work?
So we do accept walk-ins, but this year we are encouraging people to do an online appointment. A couple advantages with the appointments is that it lets you reserve a time slot to come in. Our scheduling tool, it's every 10 minutes because, we work you into our workflow. But the biggest advantage is you answer our questionnaire online. You do not have to handle clipboards and answer the questions once you come into the store. It streamlines it for you and for us. And then also, if you don't do it ahead of time, you can come right to the pharmacy. There's a QR code at our drop-off and pickup windows. You can scan that, answer the questionnaire on your phone immediately, pops into our computer and that way. So a couple different ways to go contactless once you come in to get your vaccine.
Now, if you come in to get a flu vaccine, there are choices between different vaccines, are there?
There are a couple choices. So
okay.
There's one that we carry, which is approved by the CDC age 6 months and above. There's another one, it's called recombinant. It is only approved age 18 above. A couple advantages with that one. It's not grown in an egg, so for people who have egg allergies, that's a good choice for them to get that, but they have to be age 18 above to receive it. Mm-hmm. The other thing is that even though it's the same 4 strains, studies show that people between age 50 and 65, that don't get that high-dose vaccine, they get a better immune response. Even though it's the same 4 strains, I think maybe it's the way it's manufactured and not in the egg, that it gives their body a better immune response, which is an advantage. So we recommend that one for everyone 50 and above. Those under 50, the choice is theirs.
And I guess if you have a question about it, talk to the pharmacist.
Exactly. That's what we're here for.
We're talking with Doc Lamberjack from the Kroger Pharmacy about the flu vaccine this year. And I guess there are probably lots of questions from people this year because of COVID. There is something called COVID antibody testing.
Mm-hmm.
What is that, and do you offer that at Kroger?
So we will soon be offering that at Kroger. We do have a couple of our divisions across the country. So the Kroger stores in Michigan and then our Ralph's grocery store chain out in California are doing it right now. Mm-hmm. We are supposed to be doing it by the end of November. It is a $25 charge, so we do not bill insurance for that. It's called a rapid finger stick. So we stick your finger, put it in the little device to read it, and in about 15 minutes you get the results. So for those people that want to find out if they have had COVID and that they have the antibodies, we would recommend them doing that before they do their grocery shopping, because they can swing back after 15 minutes and get their result right then. Now,
back to the flu vaccine again.
Yes.
Is there a charge for it, and do you take insurance?
So, as you can see, my sign here says free flu vaccine. So every insurance covers it at 100%. For those that don't have insurance, the charges are $40 for the traditional one, and the one that's not grown in the egg is $70. So, but I would say we have very, very few people that don't have insurance to where it's not covered for them.
So, I guess the bottom line is, if you're thinking about getting your flu vaccine, number one, yes, get it.
Yes.
And number two, how do they get more information about how to go about it at Kroger?
So if you go to Kroger.com/flu, all the information is right there. You put in your zip code. It'll bring up the stores close to you. So it also brings up the little clinic, which are the nurses' clinics inside certain Kroger stores that you can go there. They actually can immunize age 1 and above at the nurses' clinic. So if you have young ones at home that haven't been immunized yet, I would recommend making an appointment at the little clinic.
And I guess finally, let's do the important part here. You get fuel points.
You get fuel points, 50 fuel points for each vaccine. So,
well, thanks for stopping by. I know it's very important, especially for our listeners. I know 65 and above, they really need to get this, but everybody should get the flu vaccine. And Doc Lamberjack has been our guest today from the Kroger Pharmacy. Doc, thanks.
Thank you for having me again. Appreciate it.
And Doc Lamberjack from the Kroger Pharmacy giving us more information about getting your flu shot this year. Let's turn our attention now to the coronavirus and the weekly update from Governor DeWine.
These are the key indicators today. And sadly, we have a shockingly high number of cases, 4,961. This is an all-time high. And to put this in perspective, about a month ago, about 4 weeks ago, that number was about 1,000. So now it is five-fold up and seemingly continues to go up all the time. We're now at 86% of Ohioans, of our fellow citizens who are living in red counties. 80%, 6% of the population of the state is now living in a red county. 100% of the state's high incidence. That means that there are enough cases during the past 2 weeks to get the high incidence, that the risk of catching this virus in every county is very real and certainly is very concerning. As I mentioned before, our team talks to local health commissioners throughout the week. I talk to them at least once a week on Monday morning when we have all the health commissioners on a phone call. But they continue to share with us some of the stories, and we share them with you really just to kind of give you an indication of where we're seeing the spread. We're seeing significant community spread in every county. There's a lot of spread directly in households. So when one person gets the virus, so does the rest of the people who live in the home. Schools are continuing to do a great job. Social gatherings, including weddings and funerals and parties in people's homes, is really where we're seeing much of the spread. In some cases, the health departments have given us some stories, and let me just read a couple. A woman went to a wedding where she contracted COVID. She passed it on to her mother. Her mother is the caregiver for a couple in their 80s. Now the couple in their 80s have it. So you can just see it just passes from one person to another to another. Another example, a group of teachers had a Halloween party with their bubble of people that they usually spend time with. But there was another group of teachers at a party down the street. The group at the second party visited the people in the first party. As a result, there were COVID-positive people in the second group, and now more than 10 teachers are sadly quarantined. Another story. College students hosted a house party that high schoolers attended on October 24th. About 80 people attended. There are now at least 5 positive cases associated with that party. Now I want to announce some key additions to our existing team that is fighting the coronavirus and additions to our administrative structure at the Ohio Department of Health. As you can see from the numbers, we are now at a critical juncture in our fight against the virus. Cases are spiking all across the state of Ohio. They are at an all-time high. At the same time, the good news is we're closer to getting a vaccine. As someone once said, it's always darkest before the dawn. But the light is coming. I'm confident of that, and so we need to be ready for that. Our game plan is straightforward and remains straightforward. The best way that we can defeat our common enemy is by doing 3 things. We must stick to the basics to not endanger ourselves, our families, nor others. That means back to the basics. Wearing masks, maintaining distance, not gathering in groups, especially inside. We all must continue to focus on protecting those that are most vulnerable of getting the virus. And we need to go on the offense with the pending arrival of the vaccine. Now, fighting a pandemic demands a multifaceted response, one that requires us to focus on our short-term needs, but also not lose sight of our long-term goals. And so it is very important that as we battle the virus, we continue to build out the Ohio Department of Health, because the Ohio Department of Health is the epicenter for this, and they are really carrying out 2 separate jobs, related but separate. One is the normal function of the health department, which is so vitally important to the safety of all Ohioans. But the other is fighting the pandemic along with their partners at the local health level. The work of the Ohio Department of Health and the local health departments, the work they both do, working together, is vital to the well-being of all Ohioans. We have spoken in the past of the social determinants of health, which include such things as income, education levels, physical and social environments, availability of health care and mental health treatment, and other support networks. Where you live and your zip code many times plays a significant role in the health outcome. That is true for many Ohioans. The Ohio Department of Health is the foundation for our effort to promote a healthy Ohio, working with the local health departments, so that no matter where you live in this state, you have the opportunity to thrive, and that's the goal. Whether it is working on infant mortality issues or maternal mortality issues, well baby vaccines, protecting children from getting sick from lead poisoning, decreasing tobacco use, vaping, or fighting infectious diseases. The Ohio Department of Health is at the core of protecting all of us. And so, in these unprecedented times, as the Ohio Department of Health fights the pandemic with its partners at the local level, it's equally essential that we continue to support the department's core mission and work and provide the necessary medical, management, and administrative expertise necessary for the department to run as well as it possibly can. This is a critical time. The good women and men at our Ohio Department of Health have been working nonstop since the beginning of the year to fight the virus, as have their partners at the local level, and I salute all of them. They're dedicated and committed and care passionately about protecting all of us in Ohio. I'm grateful for what each one of you do every single day. I've said before that this is like a sporting event, a football game, basketball game, and we're sort of at halftime. There's no pause in the action, though, but we're sort of halfway through. We're preparing to get a vaccine out. We're also dealing with the most serious surge that we have seen thus far in the virus. And so now is the time to bring in reinforcements to the team to go on the offense and to put more players, frankly, out on the field, especially as we prepare for the arrival and distribution of the vaccine. Now is the time in the game where we need to surge in, go back on the field, do everything we can to defeat our opponent. We will win this fight, and we will win it together. In the letter that I sent to all Ohioans on Sunday, I said, once the election is over, we've got to refocus our efforts on this virus. This virus doesn't care if we voted for Donald Trump, doesn't care if we voted for Joe Biden. It's coming after all of us. And what we have in common is a desire to keep our kids in school, desire to keep our grandparents safe in nursing homes, and a desire to keep our hospitals open and functioning so that no matter what the problem is, there's room in the hospitals. These are our common goals that bring us together as Ohioans every single day.
And Governor DeWine on the worsening numbers for coronavirus in the state of Ohio this week. I'm Mark News. Thanks so much for joining us today on Columbus Concerns.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
America's talking to Fox News.
As the chilly fall weather rolls in, we want to know, what's your favorite comfort food?
Tacos.
Frozen yogurt?
I like to drink hot cocoa.
Pizza.
My favorite comfort food is chicken casserole.
Peanut butter.
Waffles. Those are warm and you can get them with chocolate chips or strawberries or anything.
French fries.
Chocolate.
My favorite comfort food is macaroni and cheese and banana pudding.
Meatloaf, mashed potatoes and corn.
Brisket.
Homemade vegetable soup.
Popsicles.
I like spaghetti and a nice crisp salad.
Chicken pot pie.
I love shrimp.
Soba noodle.
Hot chocolate and marshmallows.
Prime rib and roasted potatoes. It reminds me of family dinners when my dad was still alive.
Macaroni and cheese.
Cookie dough. Barbecue baby back ribs.
I like chicken and noodles. Homemade.
Ice cream.
Chicken fingers. I love salted caramel ice cream. I love salted caramel cheesecake.
The bagel and the schmear.
Taco Bell. Birthday cake. Any kind of fried food.
America's talking to Fox News.
Has your child swallowed your medicine, your laundry detergent, your nail polish remover? Call the Poison Helpline. Have you inhaled paint thinner, glue, pesticides? Call the Poison Helpline. Have a question about a dose, a fume, something your kid just drank? Call the Poison Helpline. Poisonings can happen at the home, on the job, or in the great outdoors. Call the Poison Helpline first for fast, free advice from medical professionals. Call 1-800-222-1222 anytime, anywhere. 1-800-222-1222. Save the number, save a life. Brought to you by the U.S. Department of Health and Human Services.
Shortness of breath, patient's confused, temp 102.
He just had an infection. What's going on?
He's becoming septic.
Antibiotics started. Bed ready, let's move him.
Infections can lead to a deadly chain reaction in your body called sepsis. Very quickly, sepsis can cause tissue damage, organ failure, and even death. If you know the risks, can spot the symptoms, and act fast, then you can get ahead of sepsis. Learn more at cdc.gov/sepsis.